Good afternoon, everybody, and welcome to this coronavirus update on the 1st of March 2020. Yes, things have been developing very rapidly, and we're looking at a global pandemic slowly taking place. There's been a lot of new countries added to the list. I think last time we spoke it was 27 countries. Currently we stand on 65 countries. Today what I want to discuss two main things. An update on the current situation and the numbers, and secondly, preparation. How to be prepared if we in South Africa and you in your own country get faced with the coronavirus, if it's not there, and in fact, if it is in your country, what to do from a practical point of view. So, let's start. Currently, we've got a situation, these are the latest figures this afternoon. Confirmed 87,000 cases, 647 positive tested, 2,949 deaths, recovered patients now 42,631. Now remember, these are the ones that were actually formally tested that they recovered. So there are many more patients that did not get to a medical facility and that also recovered. So that's why we're still looking at a mortality rate of about 2%. And remember, the people that do recover in full. They have full immunity against the virus. And another very interesting case, there has been very few children under the age of 9 that has been documented with this virus. For some reason, it's an age group that almost does not get the virus. So for the younger children, they seem to be safer against the virus. Either from an immune system point of view, we're not quite sure yet, but yeah, definitely the older age group, 70 and above, a high percentage of the mortalities have been in the 70 plus age group. So that's another thing, when someone gets the virus, don't go visit grandparents. They definitely will struggle more to get through this virus. The clinical feature stays the same. The three most important ones, definitely fever, definitely coughing, and dyspnea, which means shortness of breath or difficulty in breathing. So a little different from your normal common cold. With that, yes, also body aches and pains, but the percentage gets a little bit lower. In South Africa at the moment we still have 0 cases. Africa has had 3 now, 1 in Nigeria, 1 in Algeria, 1 in Egypt. As far as we know, they've all recovered. No other cases have been documented in Africa that we know of. Interestingly, the cruise ship that was off the coast of Japan, there were 12 South African crew members on the ship, of which 2 got infected by the virus, and they have both recovered. Plans are being made to get them back home, and obviously the normal quarantine procedures would take place, which is around about 2 weeks. So if we move on to preparation, it's very important to realize that this is a team event. This is a community event. If the community doesn't work together, we will really struggle to beat this virus. So that means you cannot go and buy all the hand sanitizer and all the masks that is available in your local pharmacy. If you have all of them and no one else has any, then the virus is going to spread and you're going to get it anyway eventually. So it's very important to know that we have to work together as a team. So firstly, hand sanitizers are a good thing. You can have some at home. It does spread from contact surfaces, so that's a good thing to have. Washing hands, definitely also a good thing, but you're not always in the situation where you can wash your hands. Fruit and vegetables are really important. We need high vitamin C levels. Natural vitamin C intake through fruit and veg is definitely number 1. We don't have a lot of citrus at the moment because it's the southern hemisphere and it's summertime. But still, there's a lot of vitamin C in berries, in pineapples, and papayas, and kiwi fruit. Also in your vegetables, things like broccoli and cauliflower, even in Brussels sprouts if you like to eat them. There's a lot of vitamin C in that. For the people that can't actually get a whole lot of fresh fruit and veg, you can definitely get some vitamin C. 1,000 milligram or 1 gram of vitamin C per day is a good thing. There's an interesting study that was done in China. Actually, they're currently still doing a study, we haven't got the results, where they give high vitamin C intravenous treatment for patients to see if that will help their recovery time. Then resting and sleeping enough is important. If your immune system is under strain and you've not rested enough and you've got a lot of stress, you will definitely struggle to get through any viral illness. Not just the coronavirus, the normal flu, H1N1, any of those, you're going to struggle if you don't rest enough. So yeah, you definitely have to rest enough. Smoking and vaping in the situation with the coronavirus is something that is really a bit of a risk. It's a high risk because this is a low respiratory tract disease. As you can see there, it affects the lungs, coughing, difficulty in breathing, more than the cold and flu would maybe affect your nose and your sinuses and blocked and all that. So if you can stop smoking and vaping, that's one of the best preparations that you can do as a person. Masks, to wear masks or not to wear masks. Remember, the normal surgical masks that we know, the paper masks, are not sufficient to protect you from inhaling the virus. It is still positive to wear because remember, if you sneeze and you cough, the droplet spreads from your mouth and from your nose, and if you can block that by wearing the mask, you protect other people. So there it does have value, but it is not absolute safe thing to wear. You do get masks like N95 masks that are a lot better to do and to breathe with to block viral spread. The problem with them is they are short of supply and you're not going to get them everywhere. And we really need to make sure that our hospital staff, medical staff, nursing staff, carers that look after old people, that they have access to those masks because they are the ones that's going to really need to help the very sick people. So please, some wisdom, some discipline in that. If you do get hold of one, yeah, that's good. But don't just hoard a whole lot of masks for yourself and then make a big crisis and a big problem with supply of masks in the country. Okay, when you are sick, now this is quite important if you do get sick. The first thing that you can do is get a thermometer. So get a thermometer so you can take your own temperature. If your temperature is not above 38 degrees Celsius, you don't qualify for testing for this virus. Yes, you might be infective, but the qualifying criteria would be contact with someone in an area or that was in an area like Italy or China. So if you have contact with those people and you've got a high fever and you've got a cough, they're going to test you. But if you don't have a fever above 38 and you feel fluish, do not just go to the hospital. Why? Because people are sick at the hospital. There are probably other infected patients in the hospital. So you're just going to get sick there, and you might also put others at risk if you just run into a hospital. So get medical advice from your local primary care sister, from your nurse, from your local GP. You can speak to them, they can have a look at you, but please do not go into a public emergency room area where they have to treat serious cases. Okay, so to summarize, we need to check temperatures with your thermometer at home. You need to not just rush to the hospital. You need to make sure that you really need to go to the hospital. The people that needs to go to the hospital, high temperature, difficulty in breathing, severe cough, they need to go to the hospital. Otherwise, primary care, nurse, physician to have a look and see. And then, like I said, do not buy all the masks and call before you go. Call before you go to the GP, call before you go to the nurse, to the clinic or to the hospital. You might go to the completely wrong place. In South Africa, we have a plan that is already drawn up by the Department of Health. They have dedicated certain hospitals that will deal with an outbreak if we do get that. So you're not going to be accepted at every hospital anyway. So that's important to know where you should go and ask before you go there. Don't just rock up and think people should help you. So I hope this has been helpful, this update. Things are really changing quite rapidly, so I think we'll make the updates a little bit more rapid, maybe every second or third or fourth day, depending on how things change. Africa is at the moment, the majority of Africa is in the southern hemisphere, and we have had basically no documented cases in the southern hemisphere part of Africa. Nigeria being the sort of the equator one, the mid-Africa one that's had the one case. So at the moment we can really be calm. We shouldn't panic. We should do the right thing. We should prepare, but we should be wise. And we need to make the right decisions and help other people. In following videos, I'll do a short information bit about traveling. What happens if you need to travel or have to travel? How do you prepare for that? and also how things change across the world, how it affects us, and the situation might change quite a lot. We don't know. But remember, be responsible, don't panic, and stay healthy.